Experts say planning before you are eligible for Medicare can have a positive impact on your health for years to come. Here to explain and share more in the sponsored interview is Dr. Jennifer Taylor, Senior Medical Director at Humana. Welcome, Dr. Taylor.
Thank you for having me.
Happy to have you. What advice would you give to people turning 65 this year or to prepare for being eligible for Medicare?
There's a few things, first of which is to start your research now, because it's important to understand all the different parts of Medicare so you can make the right decision for you. With Original Medicare, you have coverage for hospital stays and doctor's visits, but there's a deductible for each, and you're responsible for 20% of the cost. Whereas with Medicare Advantage, you have coverage for hospital stays, doctor's visits, ER visits. You might have prescription drug coverage as well at no extra cost, and there's a yearly cap on out-of-pocket expenses.
That sounds incredible. What coverage for seniors who do not have a primary care provider? What considerations would you recommend when making that choice?
Having a primary doctor that knows your health history, your own individual needs and risk factors can make a huge difference in terms of your quality of life and longevity. And your insurance provider can give you the information you need to find doctors in your area that are accepted on your plan. Here at Humana, we encourage our Medicare Advantage members to find a doctor that's involved with value-based care. Because with value-based care, you have longer visits and more frequent visits, which allows you to ask more questions and allows your doctor to get to know you better. It allows your doctor to know those personal and social things about you that might impact your health.
Doctor, what would you say are the most important things these younger seniors can do to stay healthy?
Well, once you've selected your primary care doctor, schedule an annual wellness visit, because that's where you sit down with your doctor and you go over all the preventative screenings that are available and you choose which ones are right for you based on your own risk factors. And screenings can make a huge difference in your quality of life. It's also important to understand your Medicare benefits. For example, Part B covers things you might not even think about, like tobacco screening. And Medicare Advantage offers a host of other benefits as well.
It's so personalized, and that's so important. Okay, here's a big one. How do loneliness and social isolation impact the health of seniors?
Social isolation can impact as many as 43% of our senior adults, and that puts them at high risk of negative outcomes, even death, from common conditions like heart disease, stroke, and even increases the risk of dementia. So at Humana, we try to look at the whole person, and we try to identify people who are at risk of loneliness and social isolation and get them plugged into community resources and make sure they're maximizing all the benefits that are available to them.
What wonderful information. Where can our viewers go to learn more?
The best place is Medicare.gov. You can get information on the different plans, get information on star ratings, which tell you about the patient experience. And then for more information about Humana, they can go to Humana.gov.
Wonderful. Thank you so much, Dr. Taylor. Take care.
Thank you.